Welcome, everyone. We're excited to be with you today to discuss a very, very important topic around obesity and cardiovascular health. We have a panel of experts that are with us today, and I want to shift to Dr. Miller to really talking about how do you assess the level of risk for cardiovascular disease in these patients.
Yeah, I think that's a really good point to focus on, especially in a primary care level. I would say on a generalization, my colleagues kind of wait till they have the event. I always say, I don't want to wait till you have the event.
By the time they've seen me, they've usually either gone through the primary care evaluation, or they've come in like so scared that they want to go straight to the specialist. And it is just amazing to me how often, people don't think of their weight as one of those risk factors.
In my obesity practice, I have time to actually sit down and make those connections for them and with them and talk about how their excess adiposity makes a difference in their cardiovascular health, not just their metabolic health.
I think from the cardiology perspective, obesity has been obviously associated with a great deal of cardiovascular disease. And so I think the real question from a cardiologist perspective is, how do we focus on these patients earlier in the disease process?
If I can establish, through Framingham Risk Calculator, going back through their family history, looking at the level of high blood pressure, level of excess adiposity, level of inactivity, and say, listen, we can affect risk today.
If we recognize obesity as one of the multiple things contributing to this patient's cardiovascular disease or risk of a recurrent cardiovascular event, then it should be, it should be attacked the same way that you would attack another risk factor, right? I mean, that's the bottom line.